Friends, today we are going to study about the axillary artery. It is the continuation of the subclavian artery and it extends from the outer border of the first rib to the lower border of teres major muscle and continues as the brachial artery. So here is the mnemonics such as ATM. Since there is capital M, so we should remember that it is teres major muscle. The pectoralis minor muscle crosses the artery and divides it into three parts. First part is superior or proximal to the muscle, second part posterior or deep to the muscle, and third part is inferior or distal to the muscle. Now let's see its relations. First, anterior aspect. Since the skin and the fascias are common in all the three parts, so we will only see the specific point. So in the first part there is pectoralis major, clavipectoral fascia with cephalic vein, lateral pectoral nerve and thoracoacromial artery. Loop of communication between lateral and medial pectoral nerve. In the second part there is presence of pectoralis major and minor muscle. In the third part, in its upper part, there is presence of pectoralis major as well as medial root of median nerve. Now let's see from the posterior aspect. First part, external intercostal muscle, serratus anterior muscle with nerve to serratus anterior, medial cord of brachial plexus with its medial pectoral branch. Second part, posterior cord of brachial plexus and subscapularis. Third part, radial nerve, and the upper part of third part consists of axillary nerve as well as subscapularis muscle. And in its lower part there is presence of latissimus dorsi and teres major tendons. Now from the lateral aspect, the first part consists of lateral as well as posterior cord of brachial plexus. Second part consists of lateral cord of brachial plexus as well as coracobrachialis, and third part consists of coracobrachialis and its upper part consists musculocutaneous nerve and lateral root of median nerve, and its lower part consists of trunk of median nerve. Now let's see from the middle aspect. The axillary vein is present in all the three parts of the axillary artery, and the second part consists of medial cord of brachial plexus as well as medial pectoral nerve. And the third part, between axillary artery and vein, there is presence of median cutaneous nerve of forearm and ulnar nerve. And medial to the axillary vein, there is presence of medial cutaneous nerve of arm. Now let's see the branches of the axillary artery. There are 6 branches. We can use these mnemonics such as SALSAP to remember it. From the first part arises only one branch, from the second part arises 2 branches, and from the third part arises 3 branches. So let's see the first part. It gives branch to superior thoracic artery. It supplies pectoral muscles and thoracic wall. From the second part arises first branch known as thoracoacromial or acromiothoracic artery. It emerges from the upper border of pectoralis minor muscle. It pierces the clavipectoral fascia and divides into 4 terminal branches such as, we can remember these by using the mnemonics CADP. Cadavers are dead people. From C it is clavicular branch, from A it is acromial branch, from D it is deltoid branch, and from P it is pectoral branch. So let's see the clavicular branch. It is present deep to the pectoralis major muscle. It supplies acromioclavicular joint and subclavius. Now let's see the acromial branch. It crosses the coracoid process and ends by joining anastomosis over acromion. C. Deltoid branch. It runs in deltopectoral groove along with the cephalic vein. D. Pectoral branch. passes between pectoral muscles and supplies pectoral muscles and breast. Now from the second part arises second branch known as lateral thoracic artery. It emerges and runs along lower border of pectoralis minor in close relation with anterior group of axillary lymph nodes. And in females, this artery is large and gives off the lateral mammary branches to the breast. Now let's see third part. The first branch from the third part is anterior circumflex humeral artery. It supplies the head of the humerus and shoulder joint. It anastomoses with the posterior circumflex humeral artery to form an arterial circle round the cervical neck of the humerus. Now let's see the second branch from the third part, which is posterior circumflex humeral artery. It runs backwards accompanied by axillary nerve. It passes through quadrangular intermuscular space, supplies shoulder joint, deltoid and muscles bounding the quadrangular space. And it gives off descending branch which anastomoses with ascending branch of profunda brachii artery. So the subscapular artery is the third branch from the third part of the axillary artery. It is the largest branch and it supplies the latissimus dorsi and serratus anterior muscle. Its branches are circumflex scapular artery and thoracodorsal artery. Now let us see the figures one by one and try to understand from these figures. So here is the extent and parts of the axillary artery. So the axillary artery is the continuation of the subclavian artery. It extends from the outer border of the first rib to the lower border of the teres major muscle, and from that point it continues as the brachial artery. Now the pectoralis minor muscle crosses the artery and divides it into three parts. First part is superior or proximal to the muscle. Second part is posterior or deep to the muscle, and third part is inferior or distal to the muscle. Now let's see the relations of the first part of axillary artery. First let us divide into four aspects. This one is anterior aspect, this one is posterior aspect, this one is lateral, and this one is medial aspect. So from the anterior aspect, let us see that there is skin, superficial fascia, platysma, supraclavicular nerve, deep fascia, pectoralis major, clavipectoral fascia with cephalic vein, lateral pectoral nerve, thoracoacromial artery, and there is the loop of communication, this one. Loop of communication between lateral pectoral nerve and medial pectoral nerve. Now from the posterior aspect, these are the first intercostal space with external intercostal muscle, and here is the first and second digitation of the serratus anterior with nerve to serratus anterior, and medial cord of brachial plexus with its medial pectoral nerve. And now let us see from the lateral aspect. So here is the lateral and posterior cord of brachial plexus, and from the medial aspect there is only presence of axillary vein. Now let's see the relations of the second part of axillary artery. So from the anterior aspect, there is presence of skin, then superficial fascia and deep fascia, and pectoralis major and pectoralis minor muscles. From the posterior aspect, there is presence of posterior cord of brachial plexus and subscapularis muscle. From the lateral aspect, there is presence of lateral cord of brachial plexus with coracobrachialis muscle, and there is also the short head of biceps brachii muscles. And in its medial aspect, there is presence of medial cord of brachial plexus with its medial pectoral nerve and axillary vein. Now let's see the relations of the third part of axillary artery. So the third part of the axillary artery is divided into the upper part and lower part. So here we can see that the skin, superficial fascia, deep fascia are present in both the parts, but the pectoralis major muscle and the medial root of median nerve is present only in its upper part. So this was the relation from anterior aspect. Now let's see the relation from the posterior aspect. So here we can see that the radial nerve is present in both the two parts, and the axillary nerve and subscapularis muscle is only present in its upper part, whereas in the lower part there is presence of latissimus dorsi muscle as well as teres major muscle. Now let's see from the lateral aspect. So the coracobrachialis muscle is present in both parts, but the musculocutaneous nerve and lateral root of median nerve is present only in its upper part, whereas the lower part consists of trunk of median nerve, and the medial aspect of both the two parts is same. So here we can see that the axillary vein and axillary artery, so between them there is presence of medial cutaneous nerve of forearm and ulnar nerve in both parts, and medial to the axillary vein there is presence of medial cutaneous nerve of arm. Now let's see the branches of the axillary artery. So from the first part only one branch arises, that is superior thoracic artery, and from the second part arises two branches, that is thoracoacromial or acromiothoracic artery and lateral thoracic artery, and from the third part arises three branches, that is the anterior circumflex humeral artery, posterior circumflex humeral artery and subscapular artery. So the acromiothoracic artery or the thoracoacromial artery divides into four terminal branches as clavicular branch, acromial branch, deltoid branch and pectoral branch. And the subscapular artery divides into two branches, that is circumflex scapular artery, which is the largest artery, and thoracodorsal artery. So here we finish about the axillary artery. If you guys find out my video effective, then please like, share and subscribe. Thank you.